What if I told you could have a fresher, younger look without going under the knife or taking time off of work? Is this magic? I'm Dr. Angela Sturm. I'm a facial plastic surgeon, and there are things that can make you look younger and fresher without taking off time and without having to go under the knife. Now, disclaimer, nothing lifts like a facelift. That gives you the most lift, most certainty of lift, and the most longevity. And so, disclaimer, I do love my facelifts, but that's not for everybody. And I think it does people a disservice not to talk about the whole range of everything you can do, especially when you're coming in for consult, because not everybody has the time to take off of, you don't have the budget, or that's just not what you want to do. There are a lot of things that you can do. Number one would be your liquid facelift. So this is the easiest, quickest result, most certain, I would say, that you can look in the mirror and say, okay, I like the way that looks. Can you add a little bit more here, more there? What that means is you have an injector that's using filler and neurotoxin to lift and create more of a lifted, more refreshed appearance. Usually this is like a whole facial rejuvenation. We do a full assessment of what is going to do the best for you and help you look your best now and moving forward. And so this can be multiple different kinds of filler. This can be neurotoxin. They come up with a plan that's specific for you. A lot of times we will inject in the cheeks, and for me, not too much, but just a little bit in the cheeks to replace some of this volume, create more of that oval shape compared to having more of the square shape to the face. Some of the peripheral, sometimes if your temples are really hollow, I'm not a big fan of replacing the temples for everyone, but if they are really hollow, that can create a softening of the face. And then replacing volume, especially around the mouth, especially in the chin and along the jawline, makes a big difference. Not all the areas that we lose volume are the traditional that are taught. So you have to have somebody that has that eye and is able to see where there's shadows and where the light's hitting, and how be able to replace it in a way that makes the light reflect more evenly across the full face. So that's really the trick with doing the liquid facelift, is thinking about it in an artistic way of where the shadows and where the light, and how you can make that look the most youthful. The great thing with that, you can do it in office, you do it with a little bit of numbing cream, it's done that day. You may come back for a touch-up, but you don't have specifically like follow-up appointments and things you have to do. You can go right back to work. You may have some bruising, just depending on if you bruise more easily, or that is just something that can happen. But that would be your only downtime. So that'd be nice. Come in, go back to work. You're back the next day. If you work from home, nobody even know. I've had people working from home until the appointment and start back whenever the appointment's over. So your secret's our secret. The next thing that you can do, so there are thread lifts. I am not a giant fan of the thread lifts, but they do exist and they're out there, and some people really love them. The physicians I've talked to that do them like them for the volume replacement more than anything, because if you get too much lift and you're anchoring the one end of the thread in one place and the other, where you want to lift, you may have some bunching in between. But it's enough of a lift that some patients are really happy with it. It can be done in office. At least the threads now are dissolvable. Years ago, the threads were not dissolvable, which was more of a problem, but these are, and they actually create some volume as they're dissolving. But it can be a quick, easy answer for people that want to look good right now, just want an in-office procedure. And there's skin tightening. I like the microneedling with RF. I feel like that has the best results. We have the Morpheus platform. I feel like that one's the most consistent with what I've seen. And we have a technique of numbing where it's very nice and comfortable, because that will be the one thing if you're doing your research online, you see people say, oh, it's really uncomfortable, but not if you do the numbing the way that we do it. We numb you for at least an hour, and I won't tell you all our secrets, but we have things that we do with that to make sure you're nice and comfortable. And the issue some people have of maybe doing one and not finishing it, we don't seem to have that problem. People are always coming back because they like the results and that it is very tolerable. Morpheus is one of those things that it does matter how you do it. You can do it in a way that's uncomfortable if you're not using the right technique, and the technique will improve the comfort as well as your outcome. If someone's rushing through it and they're just doing it to get it done, you're probably not going to see that much of a result. But if they're taking their time and they're doing the right number of shots, they're doing different techniques with it to be able to lift and do it in an artistic way, you have a much better chance that you're going to have a really nice result that you can be really happy with. And that downtime is pretty minimal. 3 days usually at the most, but usually by a day and a half or so, the redness is gone. You're able to put on makeup. You're able to go back to work. And so So very minimal downtime. It's great for someone that has just a little bit of laxity, wants the idea of a facelift, not ready for a facelift, or maybe doesn't need it just yet, and wants to be able to go back to work pretty quickly. Your easiest thing you can do is good skincare. Your skin that is the key, I think. If you have really nice skin, a lot of other things are forgiven. A lot of other things our eye doesn't really catch. And so depending on which age you are in, I grew up in the age of baby oil and tanning outside. And so if you're my age or older, we didn't really know about the sunscreen, and wasn't our fault, but skincare can do a lot for that. It can help reverse some of the brown spots, some of the fine lines. Moisturizing, I think, is huge, and I don't think that people talk about that enough in skincare, because for my own skin, it makes all the difference if I'm moisturizing well. This needs to be tailored to your own skin type, of course. And on top of the skincare, if you're wanting a little bit more out of it, or if you're wanting it a little bit sooner, there are lasers that can help, and microneedling that can help, and things that will help your skin look bright and vibrant. Think Lindsay Lohan. Everyone talks about her surgeries and the things she's done. What is most striking to me is her skin, because she had brown spots, she had fine lines, you could tell she lived a good life, she had a good time. And outside of, I do think she had surgeries done, and there's numbers ones that you can look at and say, I can see that. Her skin to me is the biggest difference. It's clear, it's smooth, it looks really good, it's bright, so whatever she did, whether that was a peel, whether it was lasers, whatever that was, it looks really good. And I think personally that is what we're drawn to, is she looks healthy, she looks young, she looks good. And so that is my example of take care of your skin, because that's the easiest, simplest, most effective way for people to see you as more youthful and more vibrant. I'm Dr. Angela Sturm. Let me know if you have more questions or suggestions. You can find me at www.drangelasturm.com or our podcast, Beauty Unveiled, wherever you get your podcasts.